You're listening to the Get to Know TRICARE podcast, your resource for information to help you get the most out of your TRICARE benefit. Hello, everyone. Anthony Vieira here from the TRICARE Publications team, and welcome to our final episode of the Take Command of Your Health series. In a recent episode, we talked about the importance of seeing your doctor and how these doctor visits can detect illnesses early. One of the reasons that's important is because your doctor can prescribe you medications that support your overall health. The focus of today's episode is on prescription drugs as well as the TRICARE Pharmacy Program. Joining me to break it all down is Teisha Robertson, the Lieutenant Commander with the U.S. Public Health Service and part of the TRICARE Pharmacy Operations Division at the Defense Health Agency. Lieutenant Commander, it's a pleasure to have you on the program. Thanks for stopping by for a quick Q&A.
Thank you, Mr. Vera, for having me. I'm happy to be here.
No problem. So, the TRICARE Pharmacy Program is an essential benefit available to all TRICARE beneficiaries. So, what are some of the key points they should know when using the program?
Great question. The TRICARE Pharmacy Program provides prescription drugs in a safe, easy, and affordable way for all TRICARE beneficiaries. TRICARE has 4 options in which you're able to fill your prescriptions. These options include a military pharmacy or MTF, home delivery, network pharmacies, as well as non-network pharmacies. In addition, you can get a 90-day supply of most medications and refills as needed.
And the current contractor of the TRICARE Pharmacy Program is Express Scripts. And you know what? It's great to know that TRICARE beneficiaries have a number of options to choose from when filling their prescriptions. But let's talk a little bit about costs. I understand that not all beneficiary groups have prescription costs, like active duty service members.
Yes, that is absolutely correct. Active duty service members have no prescription drug costs when using a military pharmacy, TRICARE Pharmacy Home Delivery, or a TRICARE Retail Network Pharmacy for covered drugs. It's also important to note that any medical necessity or prior authorization requirement are still required to access certain medications as approved by the Department of Defense Pharmacy and Therapeutics, or P&T committee. For other beneficiaries, though, military pharmacies and TRICARE home delivery are the least expensive options for filling prescriptions.
And to your point about filling prescriptions at military pharmacies, the convenient thing is you can find these at your local military hospital or clinic, but you can also find these pharmacies on the military base. Sometimes they are standalone shops. So, Lieutenant Commander, I understand that the way you fill your prescription at a military pharmacy depends on the type of provider you have. So talk to me a little bit more about that.
If your provider is at a military hospital or clinic, your doctor may send your prescription to the pharmacy electronically, or you can take it to the pharmacy. If your provider is a civilian, TRICARE authorized provider, call the military pharmacy to see if it can be filled. If so, ask your provider to e-prescribe or take it to the military pharmacy. If the military hospital is unable to fill it, the staff works with your provider to find an alternative, or you can fill it through home delivery or at a network pharmacy. To find a military pharmacy, visit tricare.mil/MTF.
Now, is the process any different for beneficiaries who want to fill their prescriptions at a network or non-network pharmacy?
So this varies. Ask your provider to send your prescription electronically or take your written prescription to the pharmacy. However, it's important to keep in mind you must first show your Uniform Services ID card to fill your prescription at Retail Network Pharmacy. You'll have to pay a copayment for each 30-day supply of a covered drug. At non-network pharmacies, you'll have to pay the full cost upfront and fill a claim for reimbursement for covered prescription drugs. Out-of-network cost shares, deductibles, as well as copays will apply.
And keep in mind, there are 58,000 network pharmacies here in the U.S. and in certain U.S. territories. Now, what about overseas pharmacies? Is there somewhere beneficiaries can go to learn more about those?
Overseas pharmacies are non-network. You can learn more about overseas pharmacy information in the TRICARE Pharmacy Program Handbook at tricare.mil/publications.
And as indicated with the TRICARE Formulary Search tool, certain medications are only available through TRICARE Pharmacy Home Delivery, which I understand is one of the most popular options for getting prescriptions right now. Can you talk to me a little bit about how beneficiaries can use TRICARE Pharmacy Home Delivery?
So you can order prescriptions in 3 ways: by phone, mail, or online at the Express Scripts website. With your online account, you can order refills, check your order status, look up general information about prescription drugs and health conditions, and so much more.
And I've got that Express Scripts phone number handy in case any of our listeners need it. It's 1-877-363-1303. That's 1-877-363-1303. So, Lieutenant Commander, I also understand that there's an app.
Yes, there is an app. Especially in today's time, apps have become so essential. You can also download the Express Scripts mobile app, but you need to register for an online account if you don't already have one. Log in with your Express Scripts username and password. Similar to the online account with Express Scripts, the app allows you to order refills, check your order status, and also look up general.
I think it's so great that there's an app available for beneficiaries to fill their prescriptions. I mean, it makes the process so much easier. It's something that they can use whether they're at home or on the go. So switching gears a little bit, going back to out-of-pocket costs for beneficiaries, I understand that the options for getting a prescription depend on the type of drug that they need. And we went over active duty service members not having prescription costs. What about other beneficiaries? What can you tell us about that?
Non-active duty service members have co-payments for certain drugs. Use the formulary search tool on the Express Scripts website for current prices, fill locations, and to determine if any medical necessity or prior authorization requirement apply in order to access a medication via the TRICARE Pharmacy benefit. The TRICARE cost and fee sheet also highlights the pharmacy cost information as well.
And you can find the TRICARE cost and fee sheet at tricare.mil/publications. So, Lieutenant Commander, before we wrap up, I just wanted to share a stat with you from the Centers for Disease Control and Prevention. According to a CDC study, 30 to 50% of chronic disease treatment failures in the U.S. are because of people not taking their medications. So what are some tips that beneficiaries can follow for staying on top of their medications?
According to the United States Food and Drug Administration, you should take your medication at the same time every day. Try taking your medication with a daily routine like brushing your teeth or getting ready for bed. In addition, keep a medicine calendar with your pill bottles and note each time you take a dose. Try using a pill container. When traveling, make sure you bring enough of your medication plus a few days extra. Always remember, if you have any questions or concerns about a medication, its appropriate use, or side effects, reach out to your local pharmacist or healthcare provider who can assist and provide more information.
Well, this is great information that can help so many of our beneficiaries. And here on our program, we're all about helping them take command of their health. Lieutenant Commander Robertson, I appreciate your insight. Thanks for being here.
Thank you, sir, for having me.
Of course. Well, that's it for today's episode on pharmacy and prescriptions. Remember, you can learn more about this topic by going to tricare.mil/pharmacy. And don't forget to stop by the TRICARE website for podcast episodes on other topics. For the Get to Know TRICARE podcast, I'm Anthony Vieira. Thanks for listening. We'll be back with another edition of the Get to Know TRICARE podcast soon. For the latest TRICARE news, be sure to visit our website at tricare.mil. And don't forget to contact your TRICARE contractor or your local military hospital or clinic if you have questions or need assistance.